Listeriosis has claimed the life of a Manitoba baby.
Oh, I got scared, Kenny. Oh, bastard.
Listeriosis has claimed the life of a Manitoba baby.
There has been another recall related to the Listeria bacterium. The Canadian Food Inspection Agency is warning people.
The nationwide Listeria outbreak linked to Maple Leaf meat products has exposed major flaws in Canada's food safety. Health officials say it's inexcusable that it took more than 3 weeks for test results to reach them.
Now 15 are dead and dozens of others across the country are sick.
Could the Listeria contamination at Maple Leaf Foods have been picked up earlier? Could deaths have been prevented?
It is important to note that this is an example of where our surveillance system worked.
If I was a family member of one of the deceased, I would certainly not think that the surveillance system is working great.
What should have happened is whenever you have suspicions of Listeria, that in and of itself is not uncommon. What is uncommon is to have clusters of the germ, suggesting that you could have an outbreak in 1 or 2 or maybe even 3 nursing homes. At that point, what should have happened was there should have been a signal, a red flag. There should have been word put out to the nursing homes, to public health officials, that there's something could be up. That didn't happen. Second delay came in that once the provincial lab suspected that there might be a link, they should have been able to do that testing right away. It's called fingerprinting. Instead, protocol dictated that they send those tests, or they send that request rather, to the National Microbiology Lab in Winnipeg to do the test, and so that resulted in further delay.
An editorial in this week's Canadian Medical Association Journal is criticizing government policy on meat inspections. The government has ordered an independent investigation into what triggered the deadly listeriosis outbreak, but the editorial is quite clear, saying the current government policies contributed to the unraveling of public health safeguards. For more, we're joined in Ottawa by Dr. Paul Hebert. He is the editor-in-chief of the Canadian Medical Association.
What this particular outbreak highlights for us is a crack in the system, actually multiple cracks in the system. They decided to go to a self-inspection system, which in and of itself is not a bad thing, but it's a bad thing if you do it with low standards and no procedures by which to follow up. It's not a very good thing if there's no independent public health officer to watch over in times of crisis, all of which the government did in terms of decision-making over the past year.
Both Maple Leaf and the federal government confirmed that an inspector from Canada's Food Inspection Agency was on site at the time. But the union that represents federal meat inspectors says changes to the industry, which give companies more control, have made it next to impossible to do the job thoroughly.
They're not finding the time they feel they need to actually complete all of the inspection tasks.
You have faced criticism for not being here during the listeriosis outbreak.
Well, that's actually not true.
Tony Clement is in Denver attending the Democratic National Convention. Now, Mr. Clement, I have to start by asking, why are you at the Democratic National Convention when we have what's being called a health crisis here at home?
Were you not in the U.S. at the time?
No, at the time.